Hi guys, we shall talk about sinus today. You might have heard your friends is saying that someone is having sinusitis, I'm having headache due to sinusitis or anything like this. Okay, so what is sinusitis? What is actually sinusitis? Itis means inflammation. So inflammation of the sinus is known as sinusitis. I'm sorry for the background noise. Okay, so we are talking about the paranasal sinus today. So the paranasal sinus are, you are having the maxillary sinus here, okay, that is in front of the cheekbone. Then you are having the frontal sinus over here, okay, this is the frontal sinus. Then you have the ethmoid sinus here. Ethmoid sinus is this part. Multiple number of sinuses, they form together and form ethmoid sinus. And you have sphenoid sinus, which is not very common, which is not very important for us to know. Ethmoid sinus is inside, okay, inside, deep down inside. So we are mainly talking about these three sinuses: maxillary, frontal, sphenoid, ethmoid. Okay, so yes, now what is the function of sinus? Okay, what is the function of sinus? The function of sinus is to humidify the air that you breathe in, vocal resonance, and to make the skull bone lighter. Now what is humidification? The air that you breathe in, is containing some amount of water, but if the air is very dry, it will be very irritating for your lungs, for your GI, for your respiratory tract to be counter. Okay, it will be very difficult for your GI, not GI, it is respiratory tract. Okay, so the thing is that our body will ensure to have adequate amount of moisture in the water. That is actually done by the mucus. Okay, where is this mucus produced? In the sinus. Lining of sinus is actually having mucus secretions. Okay, that is the function of one of the very important function of sinus. The second one is that vocal resonance. Please remember, whenever you are having common cold, you are having blocked nose, your voice actually changes. This voice actually changes because you are not having the sinuses, your nose are blocked, and you are not having the effect of resonance. So you're normal, you're not having common cold, then you can understand how your voice is. It's quite nice and sweet. And when you're having blocked nose in that time, and how does your voice sound like that? That is vocal resonance. Okay, and the third one, it is hollow and it makes the skull bone lighter. This is the main function of sinus. And the mucus which is produced in your sinuses, it actually drains onto your nose. Okay, it actually drains to your nose. So please remember, anything which is in a state of motion in our human body, if that thing comes into stasis, if that thing comes into stoppage, it will act as a breathing ground of organism. You are having food in your GI tract, if that thing stops, does not move in the small intestine, that will have infections. You are having urine in your bladder, you are passing urine, but you don't pass adequately, there is some obstruction, there will be retention of urine, will have infection. You are having mucus here, that mucus is stopped due to some reason, you will have infection. You'll have infection, then you'll have inflammation, and then you'll have later cases, you may also develop pus, and later cases you don't treat that also, then you'll have complication. There can be your bone can erode. Okay, cellulitis, osteomyelitis, anything can happen. So now the question is that why will my sinus be blocked? Why in the first place will my sinus be blocked? There are some multiple reasons why your sinus can be blocked. One of the common reason is that you are having deviated nasal septum. This is your nasal septum. If that thing actually deviates, imagine this septum is deviated this side, obviously this side of the maxillary sinus opening is blocked, so there will be infection here. Okay, I'll have maxillary sinusitis here. All right, so the next thing is that if you're having any sort of polyp. Now polyp, to understand polyp in a very simple language, it is that it is a hypertrophied, okay, it's hypertrophied edematous mucosal prolapse, which is non-cancer, which is non-carcinogen, which is non-cancer. Okay, in very simple language, imagine it's a muscle type of thing which is not cancer and which is prolapse, which has become loose and it has come down to your nose. Okay, it will look like grapes. Okay, that's polyp. The third thing is that if you're doing swimming, if you are going to the if you're swimming on a pond or lake, yes, because of lockdown you might not be going to the swimming pool, so you might be swimming in some natural waters. If that water is dirty, you might have sinusitis. If you accidentally swallow or you just breathe in, it happens when you swim, then you might have sinusitis. The next thing is that If you're having a habit of smoking, yes, you will have that. Next thing is that if you're staying in metropolitan cities, okay, if you're staying in metropolitan cities, yes, you'll be having sinusitis. Then if you're having any trauma, yes, sinusitis. You're having any polyp, any tumor, anything which is stopping the motion, or you have a foreign body, even a foreign body can actually do it, or you had a previous nasal surgery, any surgery, then you can have also sinusitis, because there will be edema, there will be swelling because of the surgery, and then it will compress the openings. Okay, so that is the reason you will be developing sinusitis. Now, how do you know that you're having sinusitis? Sinusitis, itis means inflammation. Please remember, whenever you are having inflammation in any part of the body, you'll be having some important features. This will be always there. Okay, you'll be having local rise of temperature. Okay, that area will be warm. The second thing is that there will be pain there. Next, there will be swelling there. Third, and the next thing is there will be redness there. And the last, there will be loss of movement. That means you don't want to move that area. Okay, let's say I'm having rheumatic arthritis in my knee, okay, in my elbow. Okay, then I'll be having swelling there, I'll be having pain there, I'll be having increased temperature there, there will be redness, and I don't want to move that area. Okay, I'm just giving an example. Any itis, any inflammation in the body, okay, you'll have that. So now you have this maxillary sinusitis, so just directly put on this symptoms of inflammation. Okay, along with maxillary sinusitis, you'll be having some special features that whenever you lean forward, this pain will go up. If you press here, you'll be having pain. There will be swelling for your cheek, and this is a canine. Okay, that's your canine. That is your canine. Canine is what you actually use to tear up muscle meat. If you go up and you press here, this is known as canine fossa. If you have tenderness, if you have pain on pressing, yes, you are having sinusitis. Along, obviously, you will be having fever, you will be having swelling, redness, local rise of temperature. This thing, you don't want to move so much. Okay, now coming to the frontal sinusitis. Okay, frontal sinusitis. How will you know you are having frontal sinusitis? Again, same inflammation, symptoms of inflammation. You will be having pain, you'll be having swelling, you'll be having redness, you'll be having local rise of temperature, and you don't want to move that area. Along with this, you'll be having headache, you'll be having swelling on the upper eyelid. Okay, swelling of the upper eyelid, and you can also have something known as office headache. Okay, something known as office headache. That means you'll be having this headache. This headache will start in the early morning, will be maximum at afternoon. The noon at 12 o'clock, and then it will slowly reduce by late afternoon. So it mimics the office hours. That is the reason it's known as office headache. Now, if you're having ethmoid sinusitis, yes, again, there will be pain, there will be temperature, increased temperature, you will be having fever, local rise of temperature, there will be swelling, there will be redness, and you don't want to touch this area. Along with this, you'll be having pain on the bridge of the nose, this part, okay, this part of the nose. With this, you will be having, if you press the medial canthus of the eye, that is the upper eyelid and the lower eyelid, wherever it meets, that is known as medial canthus, because it's on the medial side. This is lateral side, this is medial side. This is middle canthus, this is lateral canthus. Okay, so if you press there, you will be having pain. So with this, it's very kind of easy to say that you are having sinusitis, and to confirm this, you need to go and meet your ENT surgeon. Okay, what he'll do all these things again. He'll ask this question, he'll press here and he'll press here and just see if you're having any tenderness there, and then he'll ask you to do an X-ray. Okay, in X-ray he'll be able to see if there's any fluid, stasis of fluid. He'll be able to see the infection. Can he do a CT scan? Yes, he can do CT scan, but the chances are low. But the X-ray and clinical examination history will do the thing. So what clinical examination can he do? He can apply a forceps-like material, it's known as speculum, just to open up your nostrils and to see if you're having any foreign body, you're having any tumor, you are having deviated nasal septum that is mechanically obstructing the opening. Okay, if you're having any mechanical obstruction, obviously you have to do surgery to correct your DNS. There is deviated nasal septum. If you're having foreign body, just take it out. You're having polyp, surgically remove it or cauterize it. So now he knows that you're having sinusitis. Now what he'll do now? Now he'll give you a course of antibiotics. Okay, he'll give you amoxicillin clavulanate 625 mg 7 to 10 times 7 to 10 days, around two times a day. Okay, but please do not take this antibiotic just listen to me or just listen to any internet or anyone who is giving verbal, because antibiotics are very that it has to be very precise and adequate dose has to be given. But if you don't do all this, you don't take the adequate dose, you don't take the actual antibiotic, you don't take the appropriate dose, and you don't continue the course, you will develop antibiotic resistance. Okay, the bacteria which is responsible to produce the infection, you're giving antibiotic to that, but the bacteria is able to defeat the antibiotic, so next time the bacteria will be stronger, and if you give that antibiotic is not going to work. This is known as antibiotic resistance. Okay, it's a very dangerous thing in India and all these developing countries. People are not going to the hospital, they're not continuing the medical antibiotic course, and they're taking antibiotic directly from the medical shop, and then they're developing antibiotic resistance. Okay, all right, so coming back the treatment pattern, they'll be giving you antibiotics, they'll give you painkillers to reduce the pain, they'll give you to reduce the body temperature, and then they'll give you nasal decongestion to open up your nasal congestion. Okay, let's say whenever you're having common cold, there is edema here. Okay, there's stuffiness, so obviously the openings have been closed. So these are the medical treatment that he'll give you, and also he'll give you an advice that is known as steam inhalation. Whenever you take steam, whenever you boil water and the steam that has been produced, and if you inhale that steam, that is very effective to open up your sinuses. Okay, the steam inhalation is very important. All right, and so this is what he'll give you, the basic treatment. And yes, sinusitis is common. If they say you're having acute sinusitis, means the course is less than 4 weeks. If it is more than 12 weeks, yeah, they'll say you it's common chronic sinusitis. And if it is in between, like 4 to 12 weeks, they'll say it's subacute sinusitis. Okay, so sinusitis, please understand the 5 features will always be there. You'll be having pain, you'll be having localized temperature, there will be swelling, there will be redness, and you don't want to move that area. Okay, you don't want to move that area. These are always present in any inflammation in the body. Maxillary sinus, you'll be having pain in the canine fossa. You lean forward, there will be pain. Frontal sinus, again that 5 is same, and you'll be having office type of headache. And the upper eyelid, there will be swelling. Ethmoid sinusitis, same for all 5 will be there. Signs of inflammation, and with that you'll be having pain on the middle canthus. Okay, and also sinusitis, you will also have headache. Okay, so this is sinusitis. You'll do the clinical examination, do an x-ray, they'll find out you're having sinusitis. If there's any problem with your foreign body, deviated nasal septum, if there's any polyp, any tumor, they will remove by surgical process, or they'll do only antibiotics. They'll give you painkillers, they'll give you to reduce the body temperature, and they'll give you steam inhalation along with nasal decongestion. Okay, so please don't take antibiotics just from random sources. Always talk to your doctor, healthcare professional, before taking any antibiotics. Even if you know, the dose has to be very accurate, the actual antibiotic has to be very accurate, and the course has to be maintained. These 3 things are very important with antibiotics. So yes, that was a short video about sinusitis. If you have any questions, you may leave down in the comment section. I would try to answer that. And yeah, thanks.